morning, everybody. I'm Marty Velasco-Hames talking about your dental health today. And wouldn't we all like procedures that help us make us more comfortable and pain-free when we go to the dentist? And that's what we're talking today with Dr. Gordon Wilson. Thank you for being here this morning.
Well, thank you for having me.
He's a dentist here in the Valley, and he's going to show us a new laser that they are using now when it comes to dental care. Go ahead and show it to me.
Okay, well, periodontal disease affects probably 3 out of every 4 adult Americans, and a vast majority of those are moderate and severe periodontal disease, where the alternative...
We're talking gum disease,
Gum
right?
disease,
Okay.
That's correct. So gum disease. So if this is the root of your tooth and these are your gums...
Here, come look over here, Arturo.
Okay,
Go
there
ahead.
we go.
Here's a tooth right here.
The tooth is right here. Plaque forms on the tooth, and calculus, it then turns into calculus, or you've heard it called tartar, which then causes the gums to pull away, and you develop what's known as a pocket.
And what are the symptoms of that?
Bleeding gums, they begin to shift.
And they hurt?
No, actually, it's a painless disease until it gets to its final stages.
How do you know you have it then?
Well, you have to go to your dentist, and basically we go around and we take what are called periodontal readings and check the depth of the sulcus and see if it's a pocket.
Now one of the ways doctors have treated this in the past, let me just say this, they go in with a knife and they like sort of do a lot of cutting on your gums.
That's right.
That sounds painful.
They take a scalpel and they slice right along the gums to expose the diseased site, to remove the calculus, and then they stitch it back together. Now the alternative is to go in with a little fiber.
And that's Chip there in the dentist chair. He had this done a week ago.
This was last Monday. And what we're doing here is we're going to remove his diseased gum tissue with a laser, and this laser selectively removes diseased tissue from healthy tissue.
Now there are lasers out there being used in dentistry, but you said those lasers oftentimes take healthy gum along with diseased gum.
That's correct. The next best laser is called a diode laser, and it's more of like a hot knife, so it just pretty much melts the tissues away.
Is that what this is right here?
This is actually my procedure. This is the Nd:YAG, and what you're seeing come out of there is diseased tissue. The healthy tissue is being left in place.
All right, now does he have that numbing stuff on?
He is numb. We did anesthetize him, but as you can see, correct. It's minimally invasive, and there's little to no bleeding, and when it's over with, there is little or no pain at all.
Well, you know what? We'll just find that out for ourselves, Dr. Wilson. We're going to talk to Chip. He's here with us, standing by here with us live. What did that feel like? Go ahead and tell us what it felt like.
I didn't feel a thing.
Really?
Yeah, really. Then listen. I didn't go to the dentist for almost 5 years because I'm not a pain guy at all. So, you know, when he came in and he told me about the procedure, like the alternative was to open them up, scrape that stuff out of there, and then put them back together. And then he told me about the laser. I went with the laser.
Yeah, no question.
So there was no pain. He went in there in an hour and a half, did what I guess normally takes 2 months to do.
It's quicker,
Yeah, and instead of having, you know, 3 months of healing time, it's already completely healed.
It looks pretty good there.
A week and a half later.
Way to go. All right, thank you very much, Chip, for being here. And Dr. Gordon Wilson is the dentist here in the Valley, the only one of its kind in Arizona. He was one of the first, like in the world, you said, to try it.
This is the very first production model in the world.
Now, say the name of the laser real slow in case people want to ask about it.
The Periolase Pulsed Nd:YAG.